Hi, my name is LaDonna Bird, and this is a recording of my interview questions for my interview video.
Okay. Tell us about yourself.
Well, I've been in the healthcare industry for about 10 years. I initially started out as CNA. I went to pharmacy tech. After that, I currently hold an LVN license right now, where I began my first professional career. My first job was at Williamsburg Village. That was straight out of nursing school. There, I accomplished working time management was where I learned what I learned primarily at that position. After Village, I mean, I'm sorry, yes, the Williamsburg. After Williamsburg, I went to, I think it was Biomet Plasma. That was after that. And Biomet Plasma became a center medical specialist, where I was primarily responsible for making sure that the new donors were able to pass and actually donate their plasma. After Biomet Plasma, I went to Advantage Allergy Services. Advantage Allergy Services I worked for quite a while, actually. We had a couple of contracts at doctor's offices around the area where we would perform allergy testing. So there I was the allergy technician, assistant manager, trainer. So I did a lot of those management positions at that job. I held that job for about a year and a half or two until contracts expired within the doctor's offices here and they did not renew. After Advantage Allergy Services, I went to, I believe I was in PRN positions at that time because I was trying to finish my prerequisites to go back to school to obtain my BSN, which I am currently doing and in the last semester of. So my most recent professional position that I held was at the Dallas VA. Is at the Dallas VA. I am a float nurse in the subspecialty clinic, so I have worked a range of diabetic clinic, liver clinics, gastro clinic, dermatology clinic, pulmonary clinic, endocrine clinic. I've worked all of those positions. I pretty much change where I work every day, so every day is a different clinic, and that is currently where I am at this point. I've been an LVN for 6.5 years, going on 7, be 7 in January, but hopefully by then I'll have my BSN and I'll be an RN starting in January.
Okay. Where do you see yourself in your career in the next 5 to 10 years?
In the next 5 to 10 years, I see myself as a certified forensic nurse, if not at least a sexual assault nurse examiner. I plan to either work under contract with the Dallas County Coroner's Office or work in the emergency department at a big major hospital while I'm working as a site nurse.
What previous job was the most interesting or satisfying and why?
Well, all of my positions that I've held were satisfying, but better opportunities arose, so I have moved on. My current position right now at the VA is the most satisfying to me at this particular point, only because I get a range of skills in certain subspecialty clinics. As I previously explained, I work in diabetic, dermatology, liver, gastro. So I have a range of skills in each of those clinics as well as a range of knowledge when it comes to those particular specialties in those clinics. So that's really my most enjoyable right now because I'm soaking up so much knowledge in those areas.
So, talk to us about the value of teamwork. What did you do in your last job to contribute towards teamwork in the environment?
In my current position, actually, we in the liver clinic where I float to, the afternoons between the hours of 12 and 4, we can see an influx of 80 patients because that's the only time that the gastro providers are available to take clinic. So me and another coworker are trying to figure out exactly how we can improve the flow of the triage to make it easier on the providers to meet their appointment times as well as increase patient satisfaction with them in the waiting areas. We brainstormed on this for about a month or two. We finally came up with the idea of just assigning the 3 nurses that were there, which included me and her and another nurse, that we will assign them the specific appointment times, which was if She came in first. She'd take the 1 o'clock, 2 o'clock, and 3 o'clocks. If I came in second, I'll take the 1:15s, 2:15s, 3:15s. And whoever came in last or was a late nurse would take the 1:45, 2:45, and 3:45 appointment times. With 8 providers, we were still triaging at those times 8 patients for those time slots, still a piece. But with that particular assignment of the appointment times, we were able to increase the flow of the triaging, make the patient times wait less, as well as help the doctors keep up with who was there for their appointment time. So that actually increased patient satisfaction and increased the nurse relationship between the providers, and it made a smooth work environment.
Okay. Tell us about a time where you had to solve a problem with very little guidance or direction.
This happened recently here, just this week, actually, in my clinical aspect. School nurse had arranged for the staff to receive hepatitis B, hepatitis A, and flu injections through a contract company. However, it was still some sort of confusion between the employer or the staff as to when they were going to receive the next Hep A or Hep B injection. Well, since I work in the liver clinic, I have some knowledge of when those injections and how those injections come through, and I just kind of took an idea that we use at the VA, not necessarily their idea, but I kind of took a blueprint of what their idea is and made up my own, and I printed out immunization reminder cards that would let them know, hey, you get your Hep B shot. If you got one today, you come back, or you get a next one in 30 days from today, and then you receive your last one 6 months from today. So I just kind of gave them cards that reminded them of when to get those next injections, and told those to keep them in their wallet or post it on the refrigerator or something at home, somewhere where they can see it every day. But it was just about a card, probably about a 3x5 index card type thing that I handed to them, and gave them patient education over the hepatitis injection.